On behalf of USAID, I would like to welcome you to our webinar today, No Service Delivery Without Jobs, Responding to the Human Resource Challenges in the Rural Sanitation and Hygiene Workforce. My name is Jesse Shapiro. I'm the USAID Environmental Health Team Lead and a Senior WASH Advisor based in the Bureau for Global Health at USAID. And I manage the USAID Water Sanitation Hygiene Partnerships and Learning for Sustainability #2 project on behalf of USAID, who is the one who has organized this webinar and conducted the research that will be discussed today. WASHPaLS 2 is a 5-year activity led by Tetra Tech, focused on sanitation and hygiene in rural areas, and is one of a suite of research and learning mechanisms that is part of USAID's Global Water and Sanitation Action Research Initiative. This is really trying to be more than just research. It's an initiative that really seeks to support relevant, timely, and trusted evidence and learning directly for policy and decision makers and program implementers to ensure the uptake and use of that learning. The Action Research Initiative is supporting learning across a number of relevant topics, from area-wide sanitation to mobilizing financing to water resource management, including the topic of focus today, which is workforce capacity in the sanitation and hygiene sectors. We have a really exciting agenda today for you, so without further ado, it is my honor to introduce you to the Deputy Assistant Administrator for USAID's Bureau for Global Health, Sangeeta Patel. She'll tell us about why this topic is so important and for USAID and the sector. Sangeeta is a member of the Senior Foreign Service and has over 22 years experience in service to USAID supporting health programs across the globe. Sangeeta, over to you.
Thank you so much, Jesse. It really is an honor for me to be here to join you today and really to talk more about why this is so important. I feel that this is somewhat trivial for me to say, given the audience that I'm speaking to, but it is really with great humility that I approach you to say that this topic is not only critical to USAID, but it is also quite salient to our being able to succeed, particularly when we work in the areas of primary health care and even try to further things like life expectancy and survival. So for me, really, when I consider work in this space, and I consider the elements that are critical for safe sanitation and hygiene services, not only to promote global health security, but primary health care, as well as even community-based approaches that can really enhance maternal child survival. All of this is interconnected really to being able to have the ability to tackle these challenges and really understand at a community and even country level what is happening. So for me, at least, one of the key solutions has been to really tackle the scarcity of a robust, diverse, and adequately skilled workforce in this area of sanitation and hygiene. And I know that we're here today really to look at how can we effectively bridge these gaps? How can we work not only with USAID, but also with other decision makers, donors, educational institutions, as well as really in partnership with governments to tackle the human resource challenge and really look at the dynamics of what is happening in terms of the voluntary workforce, as well as even those that are official, and really try to understand how we can look more at those that are underserved, overlooked, and really mainstream, or at least try and provide further training and support so that we can then be able to have a holistic response. This oversight is particularly pronounced, as many already know, in rural settings, and it's been my experience, and as well over 22 years in working in developing countries, that it really is the on-site sanitation technologies, the community-driven services, as well as even the private sector engagement that really can drive the solutions to some of these gaps. So what we know is that the global deficit, at least for healthcare professionals, is large. According to the World Health Organization, the world faces a global shortage of almost 4.3 million healthcare professionals. This is, of course, significant because community health workers play a pivotal role when it comes to primary healthcare, sanitation and hygiene, being able to really lead key tasks such as championing really the continuum of care that's offered from a community to a facility and back, and really be able to mitigate challenges such as open defecation, as well as even promote greater hand washing. So with soap and really with water. So I think that what we need to do is be able to now unpack, especially as part of this webinar, some of those workforce shortages, and really be able to consider what are the tools that can equip professionals as well as countries when we try to bolster healthcare, and especially prepare for future challenges that are part of this sector. So the WASHPaLS 2 project has at least culminated in conducted a comprehensive workforce capacity needs assessment in sub-Saharan Africa, as well as South and Southeast Asia. And so today's webinar will really help us to unpack the current and future health and human resource needs in these sectors, and really emphasize the multi-sectoral way in which we work and the indispensable roles that volunteers and informal really providers play, and how can we capitalize on that, and how can we be able to support countries in these efforts, and really be able to consider tools to elevate the importance of these workers. So thank you for joining us today. I believe the assessment marks a pivotal step, especially in our collective understanding to confront this challenge and hopefully be able to improve progress in sanitation as well as hygiene. So back over to you, Jesse. I'm looking forward to hearing some of the recommendations.
Thank you so much, Sangeeta. All right, thank you so much. I will now pass it over to Caroline van der Voorden, who is the Deputy Chief of Party for WASHPaLS 2 and has more than 2 decades of experience in the WASH sector, to launch into our findings from the assessment. Over to you, Caroline.
Thank you, Jesse. I'm just switching screens so that I can lead myself through this. There we go. Thank you very much, Jesse. Thank you very much, Sangeeta. And thank you very much, everybody, for joining. It's a pleasure to see so many of you online for this topic. So, as explained, WASHPaLS 2 has undertaken this capacity needs assessment, and we are very thrilled to take you through really a snapshot summary of the findings and recommendations of the work we did. But before we do so, we thought it would be nice to just get a little bit of an idea of who's in the room with us. And so we've just got 2 small poll questions that I think we can get up now. There they are. Just to ask whether you work at the international, national, or more local level, and really whether your work directly touches on HR capacity development in any way. So we can't, please just vote by clicking, and then we just get a little bit of a sense of who we have with us. I think it should be up on your screens as I speak. I'm not sure. I don't know if it's just me, but I don't see anything happening.
Yes, we have the polls up, and we're gathering responses.
Okay, great. So while that's going on, I think, Joel, you can post the responses in the chat as we go, right? So I'll continue talking. So just to introduce, oh, there we go. There's the responses. Oh, great. I'm really glad to see we've got some subnational people with us as well. Because I think as we will go through the assessment, we will see how much of this comes down to capacity at the local level. So thank you very much. Nice to see such a mixed audience. So this assessment, there we go. Most of the actual data collection was done towards the end of 2022, and then we spent the first half of 2023 bringing this all together and doing the analysis. As already mentioned, we really wanted to focus on understanding workforce capacity needs, mainly for rural sanitation and hygiene, and in the context of delivering area-wide services, but then with emphasis on on-site sanitation. So we had 4 key guiding questions, which really focused on the HR capacity gaps, on the modalities for sanitation and hygiene sector capacity development, but then also really to understand barriers and incentives that could then help us identify and recommend priority actions going forward. It was a global assessment. So let's show why it's not moving forward. There we go. A global assessment. So we started doing a global desk review and key informant interviews. This work was led by our lead consultant, Kirsten de Wette, who's also online with us and available to answer questions in the chat as we go, and in the Q&A as we go along. And with Kirsten, we had a great team of country consultants who helped us do country assessments in these 6 countries listed here. Each assessment was a little different. Some included local work at a district or local government level. Others stayed more at the national level, but they all focused on those key questions outlined in the first slide. What I will say is that we did not set out to estimate the exact numerical gaps. We wanted to get a sense of how big or how small capacity gaps were, but we really wanted to understand the underlying dynamics of the gaps and of how to fill these gaps and how to address the barriers that we found. The key analysis framework that we used for the entire assessment was built around the functions that are required to deliver sanitation and hygiene service delivery from national level, so from the policy development and strategy and coordination, all the way down to construction and community mobilization, as well as business development. We started with this set of 10 functions to help us guide our assessment. As we went through the assessment, we realized that there's some more nuance, and so the final list of functions that we used and that we have incorporated in the report and in the tools going forward is a set of 13 functions. But you will see these functions being referenced throughout the assessment reports as well. So, taking you through some of the key findings and recommendations. Firstly, and sorry, I should have mentioned as well that where possible, we did use existing data, and we were very grateful to the WHO GLASS team, who actually let us use some of the data collected in the 2021-2022 survey round before the report was actually out, so that we could do analysis on those 2 regions that we were particularly interested in. And those are outlined here. So this slide is really just a quick snapshot to show that there is a significant shortage of human resources to deliver sanitation. The darker the color, the higher the shortage level, with the highest level being countries that indicated that they have below 50% of the human resources in place that they needed. So this is for sanitation. The picture looks very similar, or maybe even worse, darker for hygiene, where the human resource shortages were even larger for many of the countries. So that's the snapshot picture. We then really try to understand what are some of the key areas and key findings. And so we've brought all this together into 5 sets of findings and recommendations. The first set focuses on data, really. What we found is that countries lack sufficient information on their sanitation, hygiene, human resource needs and capacity. There are very limited human resource assessments being carried out. There is very limited systematic monitoring of the human resources available, but there is also very little standardization. And that is an issue because standardization can help plan better and also better understand which jobs are available, which jobs are required to deliver which functions and where. Under standardization, we would also put things like quota. So quota that say how many staff you would need to deliver a certain set of functions. And there are very few countries that have any kind of quota in place when it comes to sanitation hygiene roles. This then links very much as well to the environmental health roles, for example, because in many countries, the rural sanitation and hygiene functions are very much dependent on the rural health workforce. The big recommendation here is really that countries should try and undertake routine HR sector assessments, either at the national level or at a subnational level, and conduct monitoring of their existing human resources, so that this can help better develop coordinated human resource plans, costed human resource plans, and standards. Under each of the recommendations, we then worked to identify key actions or proposed actions. So under the first recommendation, if you would go to the report, you will see there are four key proposed actions. We have then worked further to really understand what some of those actions, how those actions could be taken forward. And so as an example, the first action really is to undertake WASH sector-wide or sanitation hygiene specific human resource assessments. That could take different forms depending on the different contexts that countries find themselves in and different resources available. So that could vary from organizing a national or state level workshop to just first start to discuss and understand some of the HR capacity shortages and gaps, all the way to doing a full-fledged national assessment. And so for all the recommendations and proposed actions that I might touch on very lightly here in this presentation, in the actual reports, you will find much more concrete examples of what that might look like in practice. So the second key finding is around the fact that as cross-cutting themes, sanitation and hygiene are not prioritized among the sectors and the institutions in which they fall. Rural sanitation and hygiene is not strongly prioritized. It's quite underfunded. But beyond just that lack of priority, there is also strong fragmentation. Sanitation and hygiene sit across many different ministries, different mandates, and this often leads to responsibility falling in between or not necessarily being taken, and there being a lack of champions to take forward advocacy around rural sanitation service delivery, but also really around the jobs that are required to deliver on these services. And a related issue here is the fact that local governments lack ability to develop required local HR capacity. The key recommendation linked to this set of findings is to advocate and coordinate to prioritize sanitation and hygiene job creation and fulfillment of the required functions. One example of a proposed activity or an action under this set of recommendations is to focus on local government incentive or reward schemes that really drive local government's ability and prioritization to plan for programs, to plan for service delivery, and then to plan for the human resources required. A second key proposed action here is around cross-sectoral coordination. And this comes back very much again to the fact that at the rural level particularly, there aren't very often dedicated WASH units or sanitation hygiene units. The reality is much more often that it's environmental health officers or people in the health bureau juggling many different roles and jobs. And so coordination across those different sectors is really key. The third set of findings is all around workforce conditions. And in general, what we found is that sanitation hygiene sector workforce conditions, particularly in rural areas, are quite poor. In the public sector, there's generally quite low pay, quite not very attractive working conditions. And so people that have the choice or have the option to work in more urbanized areas or in district capitals would generally take that opportunity over being posted in rural areas. And so that really affects the workforce that is available to take up positions if those positions are there in the more rural areas. A second key barrier and an issue that we really identified having a very big impact on human resources in the sector is the projectized nature of our sector. Because so much is driven, again, particularly in rural areas, by projects and programs that generally are time limited, so are people's contracts. And so this then really affects the long-term career paths and opportunities for people, but also really just distorts the longer-term institutional capacity at that level, with people keeping on moving through different jobs. Overall, we found across the 6 countries that we looked at more in depth, very large gender and age disparities. And again, this is something where if you look at the different reports, you will get more of a sense of what that looks like. For example, in Ghana, what was interesting is that if we looked at the environmental health officers, at the more local level, there was a reasonable balance in gender between women and men, more or less 50% women and men. As you looked at regional levels and then national levels, those percentages dropped to the point where at the national level, only 5% of the public sector staff working in sanitation hygiene are female. Similarly, Nigeria was a good example where, due to a variety of reasons, including hiring stops for many years, the particularly public sector workforce has really aged to a point where there isn't that natural opportunity to pass on knowledge and institutional capacity and memory to the younger generations. A last point under this finding, and I'm taking a bit of time because this is really one of the key finding areas of the assessment, is around the sector's reliance on volunteers. Because there are overall large shortages of public sector or formal jobs, in reality, particularly in rural areas, a lot of the functions around community mobilization and engagement, around construction, around some of the functions linked to operation and maintenance are generally either, but also things like monitoring, are generally either carried out by volunteers or by informal sector actors. The key recommendation here is improve sanitation hygiene sector workforce conditions. That obviously breaks out into an important subset of actions, because it's a really broad one. But one key one around volunteers is the need to improve the volunteer schemes where they exist, but really the conditions under which volunteers can work. And that includes looking at remuneration, but also really better support and training for them, as well as career development. A lot of the people performing volunteer roles do that because they see it as an opportunity to potentially grow into formal positions, like within the local government wash unit. But in reality, if those jobs aren't there, people will never be able to grow into those. Similarly, the local governments suffer from a lack of human resources and capacity, and so could actually really use the staff and the people with the experience that they have built up in this informal work. So there are definite opportunities there to build the capacity, but really institutionalize volunteers, informal sector actors, and community actors better. Let me move. Sorry. My button isn't working. There we go, sorry. The fourth set of recommendations and findings is really around the limited attraction and persistent stigma to work in sanitation and hygiene. That affects people's ability, people's willingness and interest to work in sanitation and hygiene. This links very much to what I was saying earlier about people's lack of interest to work in rural areas as well. But also, when you look at private sector engagement, there are very strong persistent barriers for their engagement due to there being a lack of enabling business environment, a lack of deliberate efforts to include the formal and informal private sector in sanitation service delivery, which therefore means that the private sector isn't necessarily motivated, encouraged, or supported to develop jobs and to become an employer in the sector and to build human resource capacity. So key recommendations here and key actions here are one, about making it more attractive for people to work in rural areas. That links a little bit to what we were saying earlier about the workforce conditions, particularly when we talk about the public sector. But it also focuses on things like stimulating youth and female engagement in the sector through more inclusive gender policies, human resource policies, but also through more explicit and proactive engagement and recruitment of women and youth. In terms of business environments, there are there's a huge set of actions that can be undertaken to strengthen the business environment and make it more interesting for private sector actors to engage and to build human resource capacity. This also links to formalizing the informal sector. The last key group of findings is around human resource demand versus supply. And really the key finding here is that demand supply are mismatched. The training opportunities are mismatched, and that this leads to competency gaps, and a lack of skills diversity overall. When we say semi-skilled graduates, what we really mean is that there are graduates coming out of training institutions in all the countries that we looked at. There are university courses, for example, around engineering, different types. There are technical and vocational education institutions that produce graduates. There are schools of hygiene that produce graduates, but there is a mismatch between the skills that they come out of school with or university with and the skills and competencies required in the jobs that are actually at hand. And one very concrete example of this is around on-site sanitation and is around the actual technologies that are being used and that are most appropriate in rural areas versus the training that particularly at the technical side that engineering students might have received. But another issue here is around the lack of skills diversity. What we found across is that people working in the sector have quite a similar background, and so there isn't necessarily a strong variety in terms of skills and competencies available. And then we're thinking really across, the spectrum from technical to administrative and management functions to competencies and skills around gender equality and social inclusion, to behavior change, monitoring, as well as digital skills. Digital skills were mentioned a lot as a key gap across all the countries that we looked at, linking particularly to the future drive and trend of using more digital platforms for monitoring, for planning, etc. So we found these common competency gaps. Another key competency gap that is worth mentioning was around safely managed sanitation, and what that actually means in practice in rural contexts and how you can achieve it. Another issue that we found that is very important and really affects sector capacity across all the countries is the uncoordinated offering of capacity development opportunities. There is a very clear identified coordination gap across and between capacity development providers and other sector actors. So key sector actors like the ministries, etc., and the development partners that work closely with ministries on program implementation on the one hand, and education institutions on the other, don't necessarily connect that well with each other to discuss the needs and requirements in terms of graduates and types of capacity and skills required, but also development partners that are active in the space of capacity development don't necessarily coordinate with each other. And so one consequence of this that we found very clearly and is highlighted in some of the country reports, is that capacity development isn't spread fairly, one would say, across countries. So in areas where there is a lot of program activity, where there's a lot of donor or development partner activity, generally there are more skilled staff, even in like the public sector there, because the programs will offer training opportunities to public sector staff, to community workers, etc. Those kinds of opportunities are not available to public sector staff or community workers that work in areas where there is less donor or development partner or program presence. And so those are some of the very concrete gaps we found geographically, as well as in terms of the types of skills being offered. And then lastly, a really important finding was around the limited on-the-job learning. Again, linking particularly to where people are based, and people that are, particularly those people working in more remote rural areas, physically do not necessarily have access to training opportunities, or need to travel long distances, which might not be practical or feasible or affordable for them. So again, there's a group of proposed actions linked to this last recommendation, including setting up human resource capacity and coordination platforms, diversifying the practical and on-the-job learning offerings, and coordinating and strengthening TVET courses and curricula, and looking more into, for example, open source sharing of curricula and training opportunities across different institutions and different providers across countries and across regions. So at this point, I will pause. The 5 key groups of recommendations in the main report are structured as well by who would take a lead in undertaking them and carrying them out. And we really group that into sort of 3 key groups of actors: the policy and oversight actors, the product and service delivery actors, and training and capacity development institutions. What is very important to note is that we found a number of barriers and dynamics at play in the sector that go beyond, or in the assessment, that go beyond the sanitation and hygiene sectors. Public sector staffing, remuneration, working conditions, civil sector workforce, a lot of that goes beyond sectoral control and influence. And so we, in the report, do discuss a little bit how what are the types of recommendations and proposed actions that we could undertake in the sector that we have some control over, but also really pointing out the need to continue to engage with other sectors, particularly with ministries of local governance or rural development, as well as obviously ministries of finance, and any other ministry really that helps understand how workforce is planned and developed across. At this point, I am taking a pause to see if there are any questions on anything that I touched on so far. And I'm aware that I stayed very high level. Again, we will make available all the links to the reports afterwards, and there's a lot more detail available there. But just to see if there's any questions or requests for clarification on what I've presented so far. So I am bringing in Morris Israel here, who is the Chief of Party of WASHPaLS 2, and who's been monitoring the chat while I've been talking.
Yeah, thanks, Caroline. And there have been a number of questions coming in. I think we've been able to address quite a few, and thanks Kirsten as well for chiming in on the chat with some of the responses. I think one of the lively bits of conversation on the chat was around the data or lack of data that is submitted to the GLAS. And as Caroline noted in the first finding and recommendations, lack of data in general is a tremendous issue for dealing with the HR issues in the country. So anything that can be done to increase both the quality and availability of the data that can be used for decision making is something that would be quite useful. Maybe even though Kirsten addressed this in the chat, Caroline, perhaps you could address this a little bit more. There was a comment that essentially the presentation stays at a fairly global level. But anything that you can say about a comparative bit between the countries, and perhaps drawing on the country assessments that we conducted. And I know this is a bit of foreshadowing to what might come later in the presentation. But again, what do we learn by looking at the comparative nature of HR in the various countries?
Thanks. Thank you for that question. And yes, and like I mentioned, because I was going through this quickly, I had to sort of stay at a higher level. A few thoughts. One is that we chose countries that are at a different point in their journey towards sanitation hygiene service delivery. There are some countries that are still facing high numbers of open defecation, that are still strongly focused on CLTS type programming and bringing people to basic levels of sanitation. And then we had some countries, particularly in Asia, that are maybe a little further ahead, that have reasonably high numbers of high levels of unimproved or improved basic sanitation, but are really looking at those next steps towards safely managed sanitation and longer term service delivery, because we wanted to understand how that affects the human resource requirements and needs that they have. And so in the reports, we speak a little bit more about the different needs and gaps that these countries had. But what was striking, that there were definitely identified gaps across, even though the situations may be different. That issue of a lack of multidisciplinary skills and competencies was found everywhere. A lack of transferable skills, so a focus on the technical roles, but less of a focus on if you like, the soft skills around management, around partnership, around leadership, around coordination, all those kinds of skills. That was identified across, as was this issue that I mentioned earlier about the lack of digital skills and digital capacity, which was identified across the board as sort of an important future trend that all countries are trying to work towards.
Okay. I appreciate it. Why don't we take one or two more, and then we'll continue with the presentation. So one, which is interesting here, it says, were there some surprises about places where HR for sanitation and hygiene was progressing and had some foundational elements in place? So
surprises.
Maybe things like the Zambia.
So yeah,
so-
and Zambia, we will get back to that, but that's definitely what we would say is a best practice we found around the fact I mentioned earlier about the lack of coordination across development, around cross capacity development providers. And Zambia has been working for with the last few years with a skills advisory group, which is a very nice model where actors across the sector come together at a sort of regular basis to assess what the gaps are and how they might be able to address them together. We definitely, I mean, there were surprises, there were patterns we weren't expecting to find. Surprises sounds positive. Not all the patterns we found were positive. If I may just mention one that we found particularly interesting, volunteers at the local level in Nigeria. We found a reasonable parity between females and males when it was about sort of the volunteers at the community level, where there were opportunities to become volunteers that were institutionalized within the local WASH units. The balance of female to male representation went down starkly. So basically, and we found similar things in the Philippines too. So as volunteer positions become more interesting, become remunerated, they become more interesting for men to take over as well. And that was so one quite interesting finding that really makes you think about the unintended consequences of how you need to plan carefully for your capacity development across the workforce.
All right, thanks, Caroline. I think that we'll hold additional questions for the end and suggest that we move on with the next part of the presentation, which references
you.
what do we do with all of this?
What do we do with all of this? So yes,
All right, thank you.
just briefly, a little bit on where do we go from here, and then we will have a bit more opportunity to address some of your questions as well after. So there we go. So, oh, sorry. So really what we wanted to do with these key findings was to see this as an opportunity to call our partners, to call the sector to action around the need to strengthen human resource capacity. And what we've done here in the next few slides is just pull together a few examples of the types of actions that we as WASHPaLS 2, as USAID, want to undertake, but also actions for partners. And so we started with identifying what we see as a set of priority actions for development partners who we know have a key role and are often in a very strategic position to push agendas and to take forward a focus on certain issues. And so from across that broader set of 5 recommendations and 21 proposed actions, we pulled out a few actions where we feel action could start. And that includes, firstly, undertaking national and local human resource capacity needs assessments. But it also includes things like ensuring impact monitoring of capacity development efforts. And this really comes back to, leading by example. Development partners are important capacity developers in their own right. We develop a lot of training and courses and workshops. We're not always that good at monitoring or tracking impact of those capacity development efforts afterwards. Going back, knowing how training is being used, how the skills that were gained in workshops or trainings are indeed being applied. But also this links to that issue of coordinating and tracking who is trained and who has had opportunity to have access to training and who hasn't. Another one is really around collecting disaggregated human resource data. To monitor the sanitation and hygiene workforce. This again is something that could start just within programs. An example here is, for example, both in Nepal and India, the push for delivering open defecation-free countries included a lot of volunteers. A huge amounts of volunteers were mobilized, but very little information about these people were tracked. And so after the first goals were met, a lot of them were, if you like, let go. And now that there is a strong focus on moving towards safely managed sanitation and those people need to be remobilized, there aren't actually data files that are easily accessible, but who these people are, where they were, what kind of work they did, what kind of training they already have, etc. Another key one is then around developing national human resource capacity action plans. And so here, again, I mentioned earlier, we really try to understand what the different context of a country means for the types of human resource capacity development planning they would need to do. And obviously there's a big difference between countries that haven't really got any data in place, that have never done human resource assessments, to countries that have already done more. And so what we've tried to do is develop some tools or some thinking around the types of activities that these different countries might want to focus on to further strengthen their human resource capacity. What we have also done as WASHPaLS is pulled out all the tools that we used to undertake the capacity needs assessment and turn those into tools and resources that people, partners who might want to consider undertaking human resource capacity needs assessments at the country level can use. And so we are in the process of putting all these tools and resources online. We'd hope to be able to have it done by today, but we're just a little behind, but they will all be online in the next few weeks. We are also, as WASHPaLS 2, seeking partners who are interested in conducting some human resource action planning. We are available to support those processes in a couple of countries. And so if this is something that is of interest, please contact us afterwards and we can discuss what that might look like. Another really important one, as we've been discussing our findings of this assessment in different venues and different conferences and with different sector partners, we've been coming up against the fact, if you like, time and time again, that human resource capacity is not generally a very prioritized issue in the bigger scheme of things linked to sanitation and hygiene service delivery. And so it's really important that we make the links to the agendas that are currently really, driving the sector forward. One key example of that is emphasizing how important human resource capacity is as a building block within the broader systems strengthening agenda of the sector, and what types of activities can be undertaken within that system strengthening agenda to further strengthen human resource capacity. Another one is really to look for opportunities to insert a focus on human resource capacity into the current focus that there is on helping countries think through how they will achieve national or local level safely managed sanitation. So an example of this is the work that UNICEF and WatchRate are doing at the moment, supporting national and state level government-led dialogues, for example, in Nigeria. Those dialogues are about what is safely managed sanitation and how can a country achieve it. But a key building block of this is the human resource capacity. And so there are opportunities to bring these discussions and more concerted planning for human resource capacity into these processes. And the last one is really around localizing efforts and strengthening national systems for training and capacity development. I was mentioning earlier, development partners have an important role to play and undertake a fair amount of capacity development, but that isn't necessary. Those are still courses that only reach, the lucky few, if you like. Even some of the online trainings, I saw a question earlier about the MOOCs, are really important, but they also only reach a certain percentage of the workforce, particularly those that are digitally skilled, that have online presence, and that often excludes people at the very local level, particularly in rural areas, who are not necessarily online, maybe not even literate, but are actually very important parts of the sanitation hygiene workforce. And so one really interesting example we came across is, again, in Zambia, is the GSS Thrive program, that is working with TVETs in Zambia to strengthen the training available to workers and public sector workers in the field, but also to roll out courses that are about providing recognition of prior and on-the-job learning. So people that haven't necessarily had official training, but have learned on the job, can go through a process where this learning and knowledge and skills that they have gathered over the years actually sort of get tested and then get certified. And so they can actually have certificates that can help them apply for more official jobs. Even if they haven't had the official training, they have now certificates that are recognized within the national setting and sector, and can help them pursue their career paths further. So that's a really interesting example. The last thing I wanted to mention is that WASHPaLS 2, we are very keen on taking forward some of the learning we have done from this assessment. And so one of the ways we are doing that is by having included this theme, or the theme of strengthening local capacity and engagement for rural safely managed sanitation services in our latest request for expressions of interest for grants that has just come out last week. So you can follow the link that is on the screen here. These are opportunities to put forward expressions of interest to undertake work around these 3 questions listed here. So this issue of improving volunteer schemes and strengthening the position and the support delivered to volunteers, questions around models for sustained supported community engagement, particularly focused on the post-ODF sustainability and on safely managed sanitation, as well as questions around how do you adapt either TVETs or technical skills-based education offerings, particularly for those people that are maybe not able to access the current offerings that are available. So people that are either more remote, people that are not necessarily so online. What are some of the opportunities we have to bring training to them in their rural areas where they work and where they need that learning? So the grants call is open until the 19th of April. I wrote it down, I just lost it. But yes, later in April. So please have a look, follow the link and see if this is of interest. Yes, the 19th of April. And if you do have questions, there is an opportunity under that link as well to send us questions, or you can send them straight to us as well about this call for expressions of interest to be awarded a small grant to take forward some of this learning. Last thing I wanted to mention is that all the resources that we've discussed today are available on Global Waters, the final report, as well as a brief, and then all the country reports as well. And the tools and resources that I mentioned are going to be online very shortly as well. At this point, I think, Morris, I'm handing back to you to see if there's a few more questions. We have a few more minutes left.
Yeah, we have just a few minutes left. And I think there was quite a few questions that came through. Again, thanks, Kirsten, for addressing some of those in the chat. But I think one that perhaps there's a little bit of discussion is the sort of the keen observation that many of the findings and recommendations that we put forward relate to the management and administrative aspects of the issues, and that the call from local government is about funding, and we need the funding. And so perhaps you could say a little bit more, and even though this assessment didn't focus on the funding that is going to this issue, perhaps you can speak a little bit, Caroline, to the issue of funding and in general prioritization of the sanitation and hygiene sectors.
Yes, thanks. And I mean, yes, very astute observation there. And to be fair, this very much influenced the title of this webinar. You know, it's about jobs. We can build people's capacity, but if there's no jobs for those people to move into, there is no service delivery, and jobs are not going to be created unless there is the funding for those jobs to be created. And so this is why finding recommendation 2 is so important. Unless rural sanitation and hygiene are prioritized and recognized and funded and financed, neither will the jobs therein. It is as well, I mean, that's, you know, jobs need to be created in the public sector, maybe first and foremost, but this is also why we focus so much on understanding the private sector, because the private sector is also an opportunity for jobs to be created and finance to be flowing. But again, this is why the enabling environment for the private sector is so important. The one other thing I will say here, the reason we spent quite a lot of time understanding the human resource capacity dynamics around volunteers and the informal sector is because the reality is that our sector is going to be relying on volunteers and informal sector actors who are, you know, underpaid and under supported and under remunerated. Given the amount of funding and finance available in our sector, that's just the way it is. And so that's why we really also chose for the work going forward to focus on questions around how we can make their situation better within those limitations that we have and that are out of our grasps.
Okay, thanks, Caroline. Maybe just one last question, and briefly, there was a few comments around how we actually assessed the functions. It goes a little bit to the methodology here, assess the functions around safely managed sanitation.
So the functional framework that we used was actually developed by and with WaterAid before that predated this assessment, and Kirsten de Vette, who's been responding to a lot of questions, worked with WaterAid on that as well. And so we were very grateful to WaterAid that they let us use that functional framework. As I mentioned, it did evolve as we were doing the assessment, and partly that was around better identifying the different functions linked to safely managed sanitation. Here it's really important though and it comes back to what I was saying earlier about there is a large lack of understanding and lack of capacity around what safely managed sanitation services are and what they mean in different contexts and for different people. Safely managed services in very rural African areas look very different than they do in more urbanized or high density areas where there's an offsite element, where there is emptying and transport, and so where those functions become much more important. So it's a framework. The framework itself is explained quite in a fair amount of detail in the report and in the annexes of the final report, if you'd like to understand.
right.
what we're
Yeah,
also
thank you, Caroline. We're quickly running short of time.
doing.
So I wanted to, we have one last poll question that I would ask to come up. It's a little bit to gauge your sense of your takeaways from this seminar. So if we could, this webinar, if we could put that up, and then Caroline, if you can go to the next slide, and while
Yeah,
that
we'll do
poll
that.
comes up, we'll begin to wrap up. So thanks again, actually, everyone, for participating. I do want to acknowledge the tremendous team of consultants that we had to administer this assessment over many months. Kirsten DeVette was the lead consultant, and so just a tremendous thanks to her for the knowledge and energy that she brought to this work. And then we depended on country consultants as well in each of the 6 countries. So tremendous thanks to that group. Just by way of wrap up, I think I'd like to go back a little bit to how Sangeeta started and imploring really the importance of needing to understand these gaps and to fill these gaps. As human resources essentially underlie every element of what we're trying to achieve through safely managed sanitation. And also understanding the important links, not just for sanitation and hygiene, but really how this impacts the primary healthcare and global health security. And I think understanding the important role of frontline health workers, the community health workers, and how those link to efforts under the broader health sector are really important to take forward. So we need to reach out outside of our own sector, understand those other efforts. In the chat, we saw that similar efforts with well drillers, with various efforts along the way. And so I think we do need to come together, to work together to advance on these issues. And we do, as Caroline noted, there is a call to action. WASHPaLS is actively pursuing some of these areas, and we would really like to hear from you if there are opportunities to work together, and then also hear from you on your own initiatives in this space. With that, again, thanks to the presenters, thanks to everyone for participating, and we look forward to engaging with you on this. And with that, we bring the webinar to a close. Thanks, everyone.